So the bad news is there's a lot of disparities. And the bad news is there are pretty large differences between rural and urban areas. However, the good news is these are all modifiable and these can all be addressed through policy.
From the USC Leonard Davis School of Gerontology, this is Lessons in Lifespan Health, a podcast about the science and the scientists improving how we live and age. I'm Professor George Shannon, Kevin Chu, Chair in Gerontology. On today's episode, how Professor Joseph Saenz is working to understand lifespan influences on cognitive ability in Mexico. Joseph Saenz is an assistant professor of gerontology at the USC Leonard Davis School, where he holds the Leonard and Sophie Davis Early Career Chair in Minority Aging. He recently spoke to us about his ongoing work on rural-urban differences in cognitive ability among older adults, as well as whether certain personality factors make people resilient to the negative effects of early life disadvantage. Hi, Joseph. It's a pleasure to be speaking with you today.
It's a pleasure to be here.
Well, to start with, why don't you tell us a little bit about the focus of your research?
Happy to. So I focus my research on looking at how socioeconomic disadvantage throughout the life course relates with cognitive ability in late life. I'm interested in education. I'm interested in income, wealth, and the resources that we have available to us throughout our lives, and how this relates with better cognitive functioning, as well as lower dementia risk in the population of older adults of Latino origin here in the United States, and also older adults in Mexico.
That's funny because just yesterday I was delivering a lecture on how differences in education, in economic status, and so forth, all of the SES differences that we work on with in terms of gerontology, how they can manifest in old age. That if a person starts out with deficits, there's a good chance that there's going to be an issue later on. So it's really perfect for me.
Exactly.
Where people live has come up as an important factor in aging research. Can you tell us why it's important to consider where people live throughout life in Mexico?
So that's a great question. One of the things that's very important about the Mexican population is we've seen a lot of demographic changes over the past century. In addition to seeing rapid population aging, with the share of the Mexican population age 60 and over increasing rapidly, we've also seen a large urbanization process where people are going from rural areas to urban areas. For example, back in 1920, about 70% of the Mexican population lived in rural areas. But by 2010, this had declined to only about 20%. So a lot of people have been going from rural areas to urban areas. And this is important because in Mexico, we see a lot of differences and a lot of disparities between urban areas and rural areas. And rural areas tend to be disadvantaged in several ways. They tend to have lower access to education. There's fewer schools for people to go to. And the educational quality that people got, especially if you look several decades ago, was significantly lower quality than their urban counterparts. Also, in rural areas, we tend to see higher rates of poverty in various measures of SES. And we also see that the rural population tends to have less access to healthcare. This has the gap between the rural and urban areas in terms of healthcare access has shrunk a little bit over the past couple of decades, but there's still a disparity there. And so when you bring up the idea of the life course and where people live throughout life, I think this is especially important in Mexico, where we saw that rural to urban population shift, that many people who are living in urban areas now were living in rural areas as children.
What kind of differences in cognitive ability do we observe between rural and urban areas?
Another great question. So the work on urban-rural differences in cognitive functioning has traditionally taken an approach where we look at people that are older adults right now that are living in urban areas, and we look at people who are living in rural areas. And we can look at those differences to see, are there differences in cognitive functioning across rural and urban areas? And in my work on this, we see that, yes, there are significant differences in cognitive ability across rural and urban areas in Mexico. with people in urban areas doing better across several cognitive domains. However, that's the work that I've done in the more traditional approach, where we look at people's cognitive ability right now and where they're living right now. So in my ongoing work, I'm using a more nuanced approach where I look at where people lived throughout life. So in doing so, I'm able to look at 4 different groups: people that spent early life in rural areas and their late life in rural areas, people who spent their early life in urban areas and their late life in urban areas, and also people that change from rural to urban areas or urban to rural areas. So that way we can look at people's individual trajectories throughout life in terms of urban dwelling and how it relates with cognitive functioning. And so in my work in this more nuanced approach, what we see is that the people that had the lowest exposure to urban areas throughout life, those who lived in rural areas in early and late life, end up doing the worst cognitively. And those who are doing the best are the people that lived in urban areas in early life and urban areas in late life. So the people that spent their whole lives in urban areas. And what we also see is that compared to people that stayed in rural areas throughout their entire lives, those who went from a rural to an urban area also show advantages. So what it looks like we're finding in our current studies is that both early life urban dwelling and late life urban dwelling are related with better cognitive ability. And there is an advantage that comes from moving to an urban area throughout life.
Okay, then you observe differences in cognitive ability, but why? Why do we observe these differences in cognitive ability between rural and urban areas in Mexico?
So I think this goes back to a lot of the disparities that we see in Mexico in terms of the resources that people have available to them in rural versus urban areas. As I mentioned earlier, the rural areas tend to have lower access to education and quality of education. And we know that education is one of the most important factors in terms of building cognitive reserve and having better cognitive functioning in later life. So it could be that people who are in urban areas in early life are able to get education, build cognitive reserve, and this is the reason that they tend to be doing better cognitively in late life. In addition to that, if we look past early life and move on to the working years that people spend, we see that in urban areas, you have a diverse variety of occupational opportunities. So in urban areas, you have opportunities to work in more cognitively stimulating work. And this could be one of the reasons that people in urban areas might be doing better cognitively, that in their work activities, they're able to continue to use their mental abilities and maintain them throughout working years and into retirement. Additionally, when we talked about access to healthcare, I think this is relevant too. Again, there are disparities in access to healthcare where people in rural areas tend to have lower rates of health insurance, are less likely to have seen a doctor recently. And I think these together can influence the ability of healthcare professionals to prevent chronic conditions and to manage them when they onset. And this is important for chronic conditions such as cardiovascular disease, diabetes, hypertension, and stroke that we know are associated with worse cognitive outcomes. And then the other reason that we could expect to see these differences between rural and urban areas, in urban areas, we know that people have high exposure to air pollution from the outdoor environment. When we look at pictures, for instance, say of Mexico City, we see the smoggy skies and we see this high level of air pollution that people are breathing in urban areas. However, in rural areas in Mexico, a significant portion of the population relies on solid cooking fuels. So this could be wood and coal. In Mexico, it's primarily coal if people are using solid fuels for cooking. And when people use these solid fuels for cooking, particularly inside the house, you can imagine how quickly the pollution builds up inside the home. So people in rural areas have greater exposure to air pollution inside the home from solid cooking fuels. And we know that exposure to air pollution is associated with poor cognitive functioning. And in my own work, looking at the effects of indoor air pollution from solid cooking fuels, I find that people who cook with these solid cooking fuels tend to have lower cognitive functioning and also more rapid cognitive decline. So I think these are all potential reasons that we could see these differences in cognitive ability across rural and urban Mexico.
Yeah, so that's pretty clear. What can we do to diminish disparities? How can we improve outcomes in rural areas?
So the bad news is there's a lot of disparities. And the bad news is there are pretty large differences between rural and urban areas. However, the good news is if we look at all of those explanations I just gave, these are all modifiable and these can all be addressed through policy. For instance, if we look at education, there's various educational policies that have been enacted throughout previous decades that have been aimed at improving access to education and quality of education in rural areas. Also, when we look at the occupational argument, we could enact policies that provide more cognitively stimulating opportunities for work in rural areas. Or if they're not getting this cognitive stimulation through their employment activities, maybe we could look for other opportunities to keep people in rural areas cognitively engaged and cognitively stimulated. Access to healthcare, again, this is something that we can address through policy. We've seen several large policy changes in Mexico in the past couple of decades that have aimed at improving access to healthcare and primarily in rural areas. And so improvement of access to healthcare, access to health insurance, and regularly seeing doctors are something that we could use to improve cognitive ability and cognitive outcomes among older adults in rural areas. And last, on the topic of cooking fuels, we know that one of the challenges and one of the reasons that people in rural areas are more likely to use these solid fuels is because maybe there's not the infrastructure to bring clean cooking fuels such as gas and electricity to more remote rural areas. Policy changes aimed at improving infrastructure to bring clean cooking fuels to rural areas and to educate people on how to cook with clean cooking fuels could be something very important to bridging these disparities that we see across rural and urban Mexico.
You've looked at rural dwelling in early life. How does early life disadvantage in general relate to cognitive ability throughout life?
So my work on early life disadvantage tends to look at poverty in early life. And so when I'm looking at poverty in early life, I'm looking at several characteristics that people report about their childhood or their living conditions growing up. So I look at people's level of education. I look at the level of education of their parents and the types of occupations that their parents worked. I also look at several characteristics of childhood, such as lacking a toilet in the home as a marker of poverty, typically going to bed hungry as a marker of poverty, not wearing shoes regularly, and having family members sleeping in the kitchen. And so we use these kinds of measures to assess early life poverty. And what we see is that these measures are very closely associated with one's level of cognitive ability in late life, that these early life exposures, these early life factors have pretty large effects on people's cognitive ability in late life.
There's an expression, cognitive resilience. Can you define that?
So great. So cognitive resilience, I think it came out of the stress literature, where what we see is that people who are exposed to high levels of stress or chronic stress tend to show diminished cognitive functioning. So we can think about times that we're having crises or are very stressed. And sometimes it's difficult to concentrate on tasks. Sometimes it's difficult to remember things when you're facing this very intense stress. And what cognitive resilience is looking at is one's ability to not show the negative effects of stress. So people who are cognitively resilient can experience stress, but don't show effects on cognitive functioning. They look like they're doing okay cognitively, even though they're experiencing high levels of stress.
Some of that must have to do with the personality. What personality characteristics do you look at in your work?
So I tend to look in my work related to personality. I look at how personality characteristics are related with one's cognitive resilience or one's ability to overcome the negative effects of early life disadvantage being a stressor that I'm considering. So the personality characteristics that I tend to look at include a locus of control, which is how strongly one feels that he or she has control over their lives. And people who have an internal locus of control tend to think that the things that happen to them are the results of their own work, that they're the results of their own choices. whereas people who have an external locus of control tend to believe it's external influences that affect their life. So they're the ones that tend to believe that maybe the bad things or good things that happen to them throughout life are the result of luck or of chance. Now, the other personality characteristic that I look at is conscientiousness, which is one's tendency to plan, one's tendency to be goal oriented, and to delay gratification. And when we look at locus of control and when we look at conscientiousness, both of these affect how people tend to cope with stressors. And we see that people who have an internal locus of control might take a more active approach in terms of coping with stressors, such as early life disadvantage.
So people with certain personality characteristics are able to overcome the negative effects of early life disadvantage?
So that's what my research tends to show. What we do is we look at people's early life disadvantage, and we're able to use people's early life disadvantage to get an idea of what we would expect their level of cognitive ability to be given their level of early life disadvantage. And so using that, what we can do is identify people who are expected to have very low levels of cognitive ability given their early life disadvantage. And so in my work, what I do is I look at people who are in the lowest quartile of expected cognitive ability given their early life disadvantage. If I look at people in the lowest quartile of expected cognitive ability given their early life disadvantage, we see that they experienced a lot of early life disadvantage. These are people that have, on average, about a year of education. The vast majority of them had parents who had no education. About 90% of them didn't have a toilet in their home. About 50% of them went to bed hungry often. So these are people that experienced a lot of adversity in early life, and we would expect to have low levels of cognitive ability because of it. However, even in this group that is in the lowest quartile of expected cognitive ability, we see that about a quarter of them actually have cognitive ability above median in late life. And so these are the people that we think of as being resilient to the effects of early life disadvantage. And these are the ones that we think are really able to overcome the effects of early life disadvantage on cognitive ability. So in my work on personality, what I do is I look at how personality relates with one's ability to overcome those effects. And we see that having an internal locus of control and having a conscientious personality are both independently related with one's ability to overcome the effects of early life disadvantage.
Well, your research certainly covers a lot of ground. What's next? What's on the horizon for you?
So that's a great question. One of the things that I want to look at next in my personality work is we know that conscientiousness and locus of control are related with one's ability to overcome early life adversity. However, in further work, what I want to do is to identify the potential mechanisms that could actually be responsible for this association. So, for example, we know that conscientiousness is related with better health behaviors, management of chronic conditions, and more effective coping strategies that could potentially mute the downstream effects of early life disadvantage. And we know that people with an internal locus of control may actively seek opportunities to build cognitive reserve through their activities throughout life. And so one of the future areas I want to work in is really trying to test some of these mechanisms to see, is it management of health behaviors, or is it management of chronic conditions? Is it better health behaviors? Is it building cognitive reserve in other ways throughout life that is the reason that people with these personality characteristics may overcome early life disadvantage?
So you're looking at people across the life course, and it sounds to me like you have opportunities to modify behavior and cognitive understanding and the ability to make better choices with one's life over a number of years, and including middle age and old age, which I think is really remarkable because it kind of speaks well of the opportunities that we all have in gerontology to try to make life better for older adults everywhere.
I think that one of the key contributions of my work tends to be the focus on the life course, as you brought up. As we talked about in both of these topics, early life is very important. And so when we're designing policies to try to improve cognitive functioning, it's important to think about the stage of the life course that we apply policies. For example, policies aimed at education point to early life, and policies aimed at employment and healthcare point to midlife to late life as well.
It's something that I began to understand, 10 years into my career, how important it is to understand that gerontology really has to do research from the beginning to the end and not just focus on older adults, but how older adults got to be the way they are, whether it's for better or for worse. And that sounds like what you're doing with your research as well. It's really interesting. Can you kind of predict outcomes with middle-aged people, for example, by looking at them from an historical perspective and then seeing where they are and then making, a prediction about the future?
Exactly. So I think that's a great point. And this is one of the things that we do in our work on early life disadvantage and resilience and cognitive ability. What we do is we're looking at people's early life disadvantage, people's characteristics in early life, and we're using those to predict where they're going to be in late life. And then we can use the difference in their predicted cognitive ability and their observed cognitive ability as a measure of resilience. But I think this is something that we could also do for these midlife characteristics. I think when we look at a lot of the studies of aging and the life course, we see a lot of focus on the conditions that people are living in late life. And understandably so, these are very important characteristics and living conditions at the time of late life. We also see a lot of focus on early life, a lot of looking at early life SES, a lot of research looking at education and childhood. But I don't think we see nearly enough work looking at midlife. I think there's a big gap in our understanding of the trajectories that people take throughout life. We don't see enough about midlife. So I think this is another area that I'd like to go into more in terms of looking at midlife. So what are the specific occupations that people worked? What are the levels of cognitive stimulation in those activities? Also looking at midlife, we could also look at people's marital histories, when they got married, whether they were married multiple times. So I think there's a lot of information out there on midlife that could be very valuable in predicting where people are going to be 10, 20, 30 years down the road.
Yeah, your research is crying out for longitudinal studies. So that's great. Thank you so much for what you've said. And you've been very informative, and it's such a pleasure to have this conversation with you. Thank you so much.
Thank you for having me.
Well, that wraps up this lesson in lifespan health. Thanks to Professor Joseph Saenz for his time and his expertise, and to all of you for choosing to listen. Join us next time for another lesson in lifespan health. And please subscribe to our podcast at lifespanhealth.usc.edu. Lessons in Lifespan Health is supported by the Ney Center for Healthspan Science and the Center for Lifespan Health.